I don't think people understand the real warning signs of diabetes. Most people think they know the signs: thirst, fatigue, frequent urination. But what if I told you the real warning signs could be showing up quietly at night while you're sleeping? Are you missing the signs of diabetes? No one wants to think about another health problem, especially right before bed. But trust me, catching diabetes early can make all the difference. In this video, we're going to uncover 8 subtle but powerful nighttime symptoms that could signal diabetes. We're going to break down each one, why it happens, and what you should do if you notice it. So stay tuned, because what you learn could save your life or the life of someone you love. Now you might be thinking, Dr. Mike, what does my skin have to do with diabetes? Well, your skin is actually your largest organ, and it can reveal a lot about what's going on inside your body, including your blood sugar levels. High blood sugar can damage your blood vessels and nerves, and that includes the ones in your skin. If you're noticing light brown, scaly patches on your shins, it might not just be dry skin. Those could be shin spots, a sign of diabetic dermopathy. And keep an eye out for dark, velvety patches on your neck or armpits. That's called acanthosis nigricans, and it's often a sign of insulin resistance, which can lead to type 2 diabetes. Ever notice a sudden increase in skin tags? While generally harmless, they can also be associated with insulin resistance. Pay attention to your skin. These changes might seem small, but they could be signaling something bigger. Have you ever taken a bite of your favorite food and it tasted off? Like metallic, salty, or even bitter? That, my friends, could be dysgeusia, and it's a lesser-known symptom of diabetes. High blood sugar can damage the nerves that control your sense of taste. And it's not just taste that can be affected. Some people with diabetes also experience phantasmia, which means smelling odors that aren't really there. Imagine smelling smoke or garbage when there's nothing around. Now, I'm not saying that every time your food tastes a little off, it's diabetes. But if you're experiencing persistent changes in taste or smell, especially if you have other risk factors for diabetes, it's worth getting checked out. Don't ignore these sensory shifts. They could be your body's way of telling you something's not quite right. This one often sneaks up on people. You might think you're just getting older, but did you know that diabetes can actually lead to hearing loss? It's true. High blood sugar over time can damage the tiny blood vessels in your inner ear, and those vessels are crucial for healthy hearing. When they're damaged, they can't deliver oxygen and nutrients to the cells in your inner ear as effectively, and that can lead to gradual hearing loss. If you're finding it harder to follow conversations, constantly turning up the volume on the TV, or missing out on sounds you used to hear clearly, don't just brush it off as aging. Get your hearing checked. It's a simple test, and it could reveal a lot more than just hearing loss. It could be an early sign of diabetes. Gum problems. Believe it or not, your mouth can tell us a lot about your overall health, including your risk for diabetes. Diabetes can weaken your immune system, making it harder for your body to fight off infections, including those in your mouth. That's why people with diabetes are more prone to gum disease. If you're experiencing chronic gum swelling or bleeding, if your gums seem to be receding, or if you have persistent bad breath, don't ignore it. These could be signs of gum disease, and they could also be red flags for diabetes. See your dentist regularly, at least twice a year. They can catch these issues early on and help you manage them effectively. Slow healing of minor injuries. We've all been there. You get a small cut or scrape, and it seems to take forever to heal. But if you're noticing that even minor injuries are taking longer than usual to heal, it could be a sign of high blood sugar and diabetes. High blood sugar impairs your body's ability to heal. It slows down the production of collagen, which is a protein that's essential for wound healing. It also impairs blood circulation, which means less oxygen and nutrients are reaching the injured area. If you have a cut that just won't close, a bruise that lingers for weeks, or a sore that seems to be stuck in slow motion, don't ignore it. These are all signs that your body might not be healing as efficiently as it should. Erectile dysfunction in younger men. Gentlemen, let's talk about erectile dysfunction, or ED. It's a sensitive topic, but it's important, especially when it comes to diabetes. ED in younger men isn't always just a sign of stress or anxiety. It can actually be an early warning sign of diabetes. Diabetes damages blood vessels and nerves throughout your body, and that includes the ones that are crucial for achieving and maintaining an erection. In fact, ED can sometimes be one of the first noticeable symptoms of diabetes, often appearing before other, more obvious signs. If you're a younger guy experiencing ED, don't be embarrassed to talk to your doctor. Getting checked out could help you catch diabetes early and prevent serious complications down the road. Joint pain and stiffness. We all experience aches and pains from time to time, right? But if you have persistent joint pain and stiffness, especially in your hands, it might be more than just wear and tear. It could be a sign of diabetic arthropathy. Diabetic arthropathy is a type of joint problem that affects people with diabetes. It happens when high blood sugar levels damage the cartilage and ligaments in your joints. If you're noticing stiffness in your fingers, pain in your hands or other joints, and it's not getting better with over-the-counter pain relievers, don't ignore it. Talk to your doctor. They can determine whether your joint pain is related to diabetes or something else and recommend the best course of treatment. Unexplained weight loss. You might think that losing weight without even trying is a good thing, right? Not always. Unexplained weight loss can actually be a red flag for diabetes, especially type 2 diabetes. In type 2 diabetes, your body becomes resistant to insulin, or it doesn't produce enough insulin. Insulin is a hormone that helps your body use glucose for energy. When your body can't use glucose effectively, it starts burning fat for fuel instead, and that can lead to weight loss. If you're suddenly losing weight without making any changes to your diet or exercise routine, get yourself checked out by a doctor. Listen, I know that was a lot of information, but it's important stuff. Remember, one of these signs alone might not mean you have diabetes. But if you're noticing several of these symptoms, especially if you have other risk factors for diabetes like a family history of the disease, or being overweight or obese, it's crucial to talk to your doctor. Early detection changes everything. Share this video with your friends and family. You never know. It might just save a life. If you found this video helpful, check out the next video that will give you more surprising ideas about diabetes. Check the sources below for reputable statistics. Stay proactive, stay informed, and stay healthy.